Welcome to Facts TV News, where everything is true. Cabby passenger shot by a cop in downtown Kingston. A taxi driver and his female passenger were reportedly injured after a police officer opened fire at the cabby in downtown Kingston on Thursday morning. Reports are that about 11 a.m., the taxi driver was traveling in the North Parade section of the commercial district when the police officer signaled the cabby to stop. The cabby allegedly failed to obey the cop before attempting to use his vehicle to hit the officer. The lawman reportedly then opened fire, hitting the driver and a female passenger who were then rushed to hospital. Personnel from the Independent Commission of Investigations are currently investigating the incident. The conditions of the injured individuals are not known at this time. 18 nurses now in quarantine, NAJ. The Nurses Association of Jamaica, NAJ, is reporting that over 80 nurses are now in quarantine after being exposed to COVID-19. NAJ's president, Patsy Edwards-Henry, says the nurses are from St. Mary, St. Anne, Mandeville, and St. Andrew. The president says nurses are also complaining about the shortage of personal protective equipment. Calls from the nurses come after a registered nurse died at the Cornwall Regional Hospital. There were 35 from St. Anne's Bay, 15 from UHWI, there were 8 at Mandeville Regional, Maypen had 8, Nutter Bay had 2. When we added, we got close to 80, and we haven't spoken to all the hospitals, she reported. The nurses, we were short before, we are now further depleted, and it just seems as if there is no end, Henry lamented. Additionally, she said nurses are again complaining about a shortage of personal protective equipment, PPE, while carrying out duties at hospitals. The public health sector is reeling from the effects of COVID-19 pandemic, which has claimed 1,549 lives. Registered nurse Deidre Davis Cunningham, who was working out of Savannah Lamar Public General Hospital, died on Monday night. She was the supervisor for the nurses in the Accident and Emergency Department. She died at the Cornwall Regional Hospital. In August, registered nurse at Percy Junior Hospital, Annette White-Best, also died from COVID-19 complications. Anonymous donor pledges $500,000 to assist COVID fight at Southern Regional Hospitals. An anonymous donor has pledged $500,000 to assist hospitals in the Southern region to treat COVID-19 patients. The donation comes as managers at Black River, Maypen, and Mandeville Hospital has been asked for support to provide medical supplies, beds, tables, and additional items to make patients comfortable and help to treat those in need of urgent care. The supply is being coordinated by David Flood of Lashes Hotel in Treasure Beach with the help of villa owners in the area. As if life cannot get more humbling, yesterday saw so many great donations come in for out of fundraising drive, and then a secret donor came in matching up to $500,000 to any monies donated from now to his humanitarian cause. This will be for specific medical items which will be agreed and approved by the Regional Health Authority, they stated. This person loves that the frontline health workers have been encouraged through this drive and that our team is delivering the items personally. This is an incredible act of great kindness. It is utterly amazing how this community has reacted, and I honestly feel quite humbled to be a tiny part of this humanitarian drive. It shows the very best of human nature, he added. The monetary pledge follows 3 days of delivering emergency supplies to hospitals by the team from Lashins, Frenchman Bay's Restaurant, and Southern Comfort Hotel, with cash donations coming from other hotels and villas in Treasure Beach area. So far, they have taken temporary beds, toilet tissues, bottles of water, cleaning fluids, and other essential items to hospital, along with hot food for staff. 19 COVID deaths, 572 new cases in 24 hours. The Ministry of Health and Wellness is reporting that 572 new COVID-19 cases were recorded over a 24-hour period up to Wednesday afternoon in Jamaica. At the same time, 19 additional COVID-19 deaths were tallied over the period August 29 to 30 and recorded on Wednesday, bringing the overall coronavirus death toll in Jamaica to 1,568. A 37-year-old female from Westmoreland and an 87-year-old male from St. Anne are among the latest COVID fatalities. The separate deaths of 10 COVID-19 patients are under investigations by health authorities, while one death has been classified as coincidental. There were also 91 recoveries on the day, bringing the overall tally to 48,493. The newly confirmed COVID-19 cases bring the total number on record for the island to 69,054. Notably, Jamaica recorded a positivity rate of 40.2% based on the samples that were tested on Wednesday. Of the newly confirmed cases, 315 are females and 557 are males, with ages ranging from 17 days to 97 years. The cases were Kingston and St. Andrew 167, St. Catherine 84, Manchester 67, St. James 67, St. Thomas 34, Westmoreland 27, Trelawney 26, Clarendon 25, St. Anne 24, Hanover 14, Portland 14, St. Elizabeth 14, and St. Mary 9. There are 184 moderately ill patients, 101 severely ill patients, and 48 critically ill patients among the 18,554 active cases now under observation in Jamaica. A total of 669 persons are now hospitalized with COVID-19 in the island. MOH rejects claims made by IGL over medical oxygen supply. The Ministry of Health and Wellness has denied claims made by Jamaica's sole supplier of medical oxygen to the country, IGL Limited, that the ministry neglected to provide forecasts of its island's need for medical oxygen despite repeated requests from the company. Last weekend news emerged that oxygen supplies had fallen critically low, leaving hospitals struggling to care for critically ill COVID-19 patients, some of whom have been placed in surgical wards and intensive care units due to the increased number of cases in the country. In a lengthy explanation on Thursday, the ministry said it began discussions with IGL in May after reviewing the country situation at the time, including the COVID-19 reproductive number. The ministry said at the time it projected that a third wave would result in over 10,000 cases confirmed in the peak week, over 180 deaths in the week following the peak, and the over 1,000 beds would be required in hospitals for COVID-19 management. At the time of these estimates, the ministry said it consulted with IGL and discussed that the last peak in March, just over 300,000 cubic meters of oxygen was utilized in the public health system for the 1-month period. In that conversation, the company indicated that based on its contingency plans that it had now put in place, it has the ability to supply just over 400,000 cubic meters for a similar period if the country went into a third surge, the ministry statements added. The estimated based on IGL supply was that the country would be able to provide oxygen up to a possible 30% more than last peak. 30% above peak demand would be approximately 1,000 beds occupied for COVID-19, it added. This level was also consistent with the ministry's internal capacity for staffing to support beds assigned to the critical management of persons affected by SARS-CoV-2. At and above the 1,000 beds occupied level, the ministry's contingency plan required that hospitals be placed in emergency mode, which included the reduction in which they use public hospital island-wide through the restriction in conducting emergency care services and the suspension of elective surgeries, the statement continued. The plan also required that health facilities would begin discharging patients who can receive home care. At this level as well, more wards would be converted to care of COVID-19 patients. These actions are to mitigate the overwhelming of the health system as well as to manage the use of oxygen to below the capacity levels indicated by IGL, the ministry said. On Wednesday, August 25, 2021, IGL informed the government that based on its plan and due to the increased demand, IGL has been importing liquid oxygen to supplement its capacity in the country. The company also advised that one of its major suppliers of oxygen out in the United States had declared force majeure as short notice and would not be able to provide its projected shipment of oxygen. This was due, in the main, to increase the demand in a source market, and this reduced IGL's capacity to supply the agreed volume of oxygen, the statement read. IGL therefore informed the ministry that over the next 3 to 4 days, we will especially be challenged. We have several tanks expected to arrive on the island Sunday, August 29, 2021, and that is in making arrangements with the authorities to clear them immediately as the ship docks. The company further informed the ministry that they would commence distribution early Monday morning and would normalize supplies by the night of Monday, August 30, 2021, it said. The Health Ministry also noted its estimation of the use has been presently surpassed the capacity of oxygen as projected and based on the company's own assessment of its capacity to meet the demands of a third wave. The issue that affected supply, therefore, was based on the break in the supply chain due to the declaration from Fort Major and the need for IGL to find, in a relative short period of time, a secondary supplier, the ministry said. At the time of this advice, the government made several outreach through diplomatic, military, and other channels to mitigate the risk that would arise. However, due to technical nature of the transportation of oxygen, none of these mechanisms would improve the timeline for the arrival of oxygen in the health facilities, it added. It is to be also noted that in many conversations with the company, at no time was the Ministry of Health and Wellness or the government informed that IGL could not provide its present demand at approximately 1,000 beds, which was in keeping with our estimation from May 2021, it said. Additionally, at no time was there to be a stock out of supply, as the company gave assurance that its logistic management mechanism would enable health facilities to meet the needs of patients on beds while it regularized service due to its supply chain issues, the ministry said. The ministry said that since this week, based on revised projection, it has indicated to IGL that there will be a need to further increase supplies. IGL has responded that it would be negotiating with its supplier to facilitate increased supplies as much as possible based on the ministry's estimation, the ministry stated. Please remember to subscribe, like, share, and click the notification bell for daily updates.